We have 12 pair of the rib or costa. It is the first rib. As you know, the first rib has posterior end, body, and anterior end. Anterior end of the first rib is going to be continued by the first costal cartilage. For the first rib, you can explain and describe two surfaces, superior surface and inferior surface, two border, medial border and lateral border. In the superior surface of the first rib, you can find two grooves that these are going to be separate from each other by a crest, by a ridge. The superior sulcus here and the posterior sulcus is here. Posterior sulcus, it is a site that it has relation with the subclavian artery, and this anterior sulcus has relation with the subclavian vein. And you have to know the posterior end of the first rib. Here you can find the head. In the head of the first rib, you can find one or single articular facet. It is going to articulate with the body of the T1 only. The neck of the first rib is here. It is lateral compared to the head, and lateral to the neck you can find the tubercle. This is the tubercle. For the first rib, the tubercle and the angle, both of them are here. So the first rib is the rib that you can find so many curves in this rib. For the second rib, all of the features belong to the typic ribs, only about the surface. About the surface for the second rib, we can explain superior lateral and inferior medial surface. But such as the other typical ribs, for the second rib also you can explain posterior end, head, neck, tubercle, body, anterior or external end, medial border and lateral border. And about the typical rib, I choose this rib. About the typical rib, I can explain only one of them. All of the features that I explained for this rib belong to the other member of this typical group. For the typical rib, you can explain the posterior end, neck, and the tubercle. For the posterior end or the head, for the typical rib, we are able to find two articular facets. These two articular facets are going to separate from each other by a crest. The inferior facet is going to articulate with the body of the same number of the thoracic vertebra, such as the rib. For example, if this rib belongs to the fourth rib, so the inferior facet is going to articulate with the body of the T4. And superior articular facet is going to articulate with the body of the T3. About the neck, here you are going to look at to the neck and lateral to the neck. I am able to show you the tubercle. About the tubercle, we can explain two sides. For the tubercle, we can explain two sides. Please look at this, it is better. One of them, the tubercle, consists of two parts, the articular facet and non-articular facet. The articular facet of the tubercle is going to articulate with the transverse process of thoracic vertebra. So the ribs, the head, are going to articulate with the body, and about the first 10 rib, you can find tubercle of the rib. In the tubercle of the rib, you can find the articular facet. These articular facets are responsible to articulate with the transverse process of the first thoracic vertebra. And lateral to this articular facet, you can find non-articular facet. This non-articular facet is a place for attachment of lateral costotransverse ligament. So lateral costotransverse ligament are going to attach to non-articular facet of the tubercle. And you have to know all of the typical rib consists of two borders, two margins, superior border, inferior border, medial surface and lateral surface. So internal and external surface. In the medial surface, if you come down, you can find a groove that called the costal groove. As you know, inside of the costal groove, you can find intercostal neurovascular bundle, artery, vein, and nerve. All of them are passing through the costal groove. About the 11 and 12 rib, you are not able to find the tubercle. And here, as you know, as you can find, here is not any tubercle. About the vertebra, please look at this vertebral column. As you know, the vertebra in the cervical region, for the first vertebra we call atlas. As you know, the atlas, you cannot find the body. You can find lateral mass. Superior to the lateral mass, you can find the articular facet. These articular facets are going to articulate with the occipital bone, with the skull, and inferior articular facets are responsible to articulate with the second cervical vertebra. The second cervical vertebra, called the axis, has body, and superior to the body you can find a dens. This dens projects superiorly. About the body and the vertebral arc, please look at this foramen called the vertebral foramen. Vertebral foramen inside of the cervical region is the largest foramen. About the cervical vertebra, you have to notice to the spinous process, all of them are bifurcation to two parts. And about the cervical vertebra, as you know, all of the transverse process at the root, you can find a foramen. Only in cervical vertebra, at the root or the base of the transverse process, you are able to find this foramen. And this foramen, after you in the cutoff, you can find that the vertebral artery are passing through this foramen. Now about the thoracic vertebra. In the thoracic vertebra, you know that each of them consists of the body. The position is anteriorly, and the vertebral arc. Vertebral arc consists of two pedicle, two transverse process, two superior articular facet or process, two lamina, one spinous process, and two inferior articular process. Between the body anteriorly and the vertebral arc posteriorly, we are able to show you the vertebral foramen. When the vertebral foramen, here you find, and all of the vertebra articulate to each other, this foramen continually are going to make the vertebral canal, and inside of the vertebral canal you can find the spinal cord with the covering sheet that called the meninge. So about the body, about the vertebra, you have to find the body, pedicle, transverse process, superior articular process, lamina, spinous process, and inferior articular process. When two adjacent vertebrae in the thoracic vertebra, here, if you look at here, two thoracic vertebrae, the body anteriorly are going to articulate through the intervertebral disc, and it is a kind of symphysis. And now the inferior articular process of the superior thoracic vertebra and the inferior articular process of the superior vertebra and superior articular process of the inferior vertebra articulate to each other, and it is a kind of synovial joint and called the zygoapophyseal joint. Look at the zygoapophyseal joint, anterior to zygapophyseal joint here, I am able to show you the intervertebral foramen. Intervertebral foramen connect to vertebral foramen. So vertebral foramen is here and here, called the intervertebral foramen. Inside of the intervertebral foramen, you can find the spinal nerve. The intervertebral foramen superiorly and inferiorly are going to have relation or bonded by the pedicle, anteriorly by the body and intervertebral disc. For the first 10 thoracic vertebra, you can find articular facet on the transverse process. Here is transverse process in each side. Anterior surface of the transverse process. For the first 10 thoracic vertebra, you can find articular facet. These articular facets are responsible to articulate with the articular facet of the tubercle in the rib. If you remember, I show you the posterior end of the rib, I show you the articular facet. The head is coming and making the joint with the body. Here it is going to make the joint with the body, and this articular facet is going to articulate with the transverse process and called the costo-transverse joint. It is a kind of synovial joint. The head is going to articulate with the body and called the costo-vertebral joint. This also is a kind of synovial joint. Now, when we come down and we go to the lumbar region, look at the lumbar vertebra. Lumbar vertebra, the body is going to change to the V shape, very large, because of the bearing of the weight, and also it consists of the superior articular process in the lumbar region. Superior articular process, if you notice, you can find the mammillary process. This mammillary process make concave this articular facet. So in the lumbar region, two adjacent vertebrae are going to lock to each other, and you are not able to these two lock to each other, and you are not able to separate, or you are not able to rotate. Only limit the rotation, and only the person can do the flexion and extension. About the vertebral foramen in the lumbar region is smaller than the cervical vertebral foramen, and it is larger than the thoracic vertebral foramen. About the lumbar vertebra, you have to know the lumbar vertebra. Here you can find that the spinous process is quadrangular and it is directed horizontally, but in the thoracic region the spinous process is long and it is going to be directed inferiorly and posteriorly. They are going overlap to each other, and so as I explained for you in the theory, in the thoracic region you are not able to access in the thoracic region. If you look at two adjacent thoracic vertebra, these spinous processes are going to overlap to each other, and so you are not able to access to the vertebral canal in the thoracic region. Here, inferior to lumbar vertebra, we can speak and explain for you the sacrum. Sacrum at the first consists of 5 sacral vertebrae, but with the age they are going to fuse to each other, join to each other, and make one single large triangular bone. Has 2 surfaces, anterior surface that concave, posterior surface here. In the anterior surface, because the sacrum consists of 5 segments, so you are able to find 4 horizontal line, 4 horizontal ridge. These 4 horizontal ridge explain that at the first this sacrum consists of 5 segments. Anteriorly, you are able to find 4 anterior sacral foramen, and about the first sacral vertebra, it is the largest, and the anterior and superior border of the first body of the swan project anteriorly and called the here we call the promontorium. In the midwifery, this is a good landmark to measure the diameter of the pelvic. And posteriorly, look at here, in posterior surface of the sacrum, I'm able to show you 5 crest, middle or median sacral crest here. Median sacral crest is going to be formed by fusing of the spinous process about the S5 or the last sacral vertebra. The lamina disappear, so make a hiatus here that called the hiatus of the sacral, and here this part of the hiatus sacral called the horn or corn of the sacrum. In each side of the median sacral crest, you are able to find the medial sacral crest. Medial sacral crest will be here, and lateral to the posterior sacral foramen, you are able to find the lateral sacral crest. The medial sacral crest is going to be formed by fusion of the superior and inferior articular process, and the lateral sacral crest are going to form by fusion of all of these 5 transverse processes. Now here you are able to find the sacral canal. As you know, the coda equina, the distal spinal nerve are passing through this sacral canal, and then only the S5 and the last spinal nerve are leaving the sacral canal through the sacral hiatus. Posterior, here you are able to find the posterior sacral foramen and anterior sacral foramen. The posterior and anterior sacral foramen are a foramen that the anterior and or ventral and dorsal fiber of the sacral nerve are leaving the sacral canal through the anterior and posterior sacral foramen. And inferiorly, here you are able to look at to the coccyx. In the coccyx, you are not able to find the vertebral arc, so you are not able to find the vertebral canal. The superior articular process of the first coccygeal bone called the coccygeal horn or coccygeal corona, and these 2 bodies are going to articulate to each other and make the sacrococcygeal joint. It is a kind of symphysis, or it is a kind of cartilaginous joint. Okay.